Good afternoon. This is Munifa, co-events lead for the Women's Network, and we're here today with Dr. Carrie Hossler, just as a recap to the presentation she did for us today on Well Woman Care. Could you just go ahead and tell us a little bit about you, please?
My name is Carrie Hossler. I am a physician at Penn State Health in Hershey, PA. I work in the Department of OBGYN and within the Women's Health Division in the Department of OBGYN. The Women's Health Division is comprised of about 20 other physicians and advanced practice clinicians, and we provide routine care to women for their gynecologic and obstetric needs. I currently serve as the division chief for the Women's Health Division and also as the residency program director for the OBGYN residency program at Penn State Health.
Pretty impressive stuff there. Well, thank you for sharing a little bit about you. So a pretty common question that women have are, what are the guidelines for pap smears? Can you tell us about that?
So as gynecologists, we recommend that women obtain their first screening pap smear at the age of 21. The pap smear is a test that we use to detect cervical cancer or precursors to cervical cancer called cervical dysplasia. This is, again, something that we recommend that women start getting at the age of 21. Prior to the age of 21, we actually don't recommend physical exams or pap smears unless there's a problem or a concern. Between the ages of 21 and 30, we recommend that women get routine screening pap smears every 3 years. And we do encourage women to continue to come in even on the off years to get an annual exam and have a physical exam by their gynecologist, even if they're not due for a pap smear that year. Then between the ages of 30 and 65, we, in addition to doing the screening pap smears, we also recommend that women get testing for high-risk HPV. HPV is a virus that we know can cause cervical cancer, and there are certain strains of HPV that increase your risk of developing an abnormal cervical lesion or cervical cancer. Between the ages of 35, the screening consists of pap smear plus screening for high-risk HPV, and when women get both of those, that's called co-testing, and that co-testing should happen every 5 years. Now again, we do recommend that women continue to come to the doctor every year for an annual exam, and they should have a thorough breast and pelvic exam at a minimum during those visits. And if they're not due for a pap smear, they should at least have an exam where a provider looks at their cervix to make sure that everything looks normal. However, in the absence of an issue or concern, that testing consists of, again, pap smear and HPV co-testing every 5 years. Then once women turn 65, we recommend that they can actually stop routine screening for cervical cancer with no more pap smears and no more testing for high-risk HPV unless they have a history of abnormal paps in the past.
Wonderful. That's some really great information, and I'm so happy to be able to share this with everyone here. We want to just thank you again for coming to the site and sharing your information on Well Woman Care, and you have a great day.
Thanks so much for having me. It was great to be here.